If you've ever braced yourself before sex and thought, please don't hurt this time, I want you to hear this clearly. You are not alone, and your body is not failing you. As a urologist, I see painful sex all the time. In people with penises, in people with vulvas, in long-term relationships, and in brand new ones. Most people don't talk about it, so you end up thinking you're the only one or that you just have to push through it. You don't. Sex should not hurt. A little awkwardness here and there is normal, but if pain is something you expect, dread, or plan around, that's your body asking for help, not telling you to toughen up. In this video, I'm going to walk you through 5 simple, practical ways to reduce painful sex. Not vague, just relax advice, and not drink a glass of wine and get over it. These are real body-based strategies I talk about with patients in clinic every week. You'll learn how to work with your body's anatomy and nervous system instead of fighting it, how to use lube and position strategically, how to calm a tense pelvic floor, and how to communicate in a way that actually makes sex feel safer and more comfortable. Before we dive in, a quick but important disclaimer. This is general education, not personal medical advice. There are times when painful sex is a sign of infection, endometriosis, prostate problems, Peyronie's disease, or other conditions that need real medical treatment. If your pain is severe, new, worsening, or comes with bleeding, fever, unusual discharge, a lump, or burning when you pee, please see a qualified healthcare provider. Don't use this video as a substitute for that. With that said, let's start with something most people never hear clearly. The first way to reduce painful sex is to stop pushing through pain and start listening to it. I know that sounds almost too simple, but it's the foundation for everything else. A lot of people, especially those who were raised to be good partners, learn very early to ignore their own discomfort so the other person won't feel rejected. So you grit your teeth when penetration hurts. You let your partner keep going when your bladder feels like it's on fire. You pretend it's fine when every thrust just hits the wrong spot. Maybe you tell yourself, it'll get better if I just relax, or it's always been like this is just how my body is. Here's the problem. When you override pain, your nervous system learns that sex, say, danger. Your muscles tense up more the next time. Your brain starts scanning for what might hurt. You disconnect from your own sensations just to get through it. Over time, this can increase pain and reduce sensitivity to pleasure. Instead, I want you to adopt a new rule. Pain is a red light, not background noise. That means if something hurts, sharp, burning, stinging, deep aching, anything that makes you want to pull away, you pause or stop. You don't apologize for it. You don't power through to be nice. You treat it like you would knee pain during a run, a signal to adjust or stop before you make it worse. This doesn't mean sex is over forever. It means in that moment, you change what you're doing. Maybe you switch to a different type of touch. Maybe you change angle or position. Maybe you decide, tonight we're staying external only. The point is, you bring your body back into the conversation instead of silencing it. If you're with a partner, this can sound like, that position is a bit intense for me. Can we slow down or switch? Or, I'm getting some pain right now. Can we take a break and try something else? A partner who cares about you will want to know that information. When you consistently treat pain as a reason to pause and adjust, not something to ignore, your nervous system starts to feel safer. And a nervous system that feels safer is a nervous system that can finally turn up the volume on pleasure. Now that we've set that foundation, let's get into something very practical that most people underestimate: lubrication. The second way to reduce painful sex is to take lubrication and moisture seriously. Not as an optional extra, but as standard equipment. Friction is one of the most common fixable causes of painful sex. For people with vulvas, vaginal dryness can come from a lot of places. Normal monthly hormone changes, birth control, antidepressants, breastfeeding, perimenopause or menopause, stress, not enough arousal time, or just your own natural baseline. None of that means your body is broken or that you're not attracted enough. It means the tissue needs a bit more help to stay comfortable. For people with penises, a very dry environment can irritate the skin, especially under the foreskin if you're uncircumcised, or along the frenulum, the band of tissue on the underside. Condoms without lubrication can also increase friction and discomfort. The fix sounds almost too obvious. Use lube. but there are a few details that really matter. First, choose the right type. Water-based lubricants are versatile, safe with condoms and toys, and easy to clean. They can dry out faster, so you may need to reapply. Silicone-based lubricants last longer and are very slippery, which can be great for people who struggle with chronic dryness or pain, but they shouldn't be used with certain silicone toys. Oil-based options like coconut oil can feel good for some people and last a long time, but they can degrade latex condoms, making them more likely to break, and they're not ideal if you're prone to vaginal infections. Second, use more than you think you need. This is not a tiny drop situation. For penetrative sex, that means lubricant on the penis or toy, and at the entrance and inside the vagina or anus. If you start to feel friction or burning, stop, reapply lube, and only continue if it feels comfortable. Third, consider regular moisturizers if dryness is an ongoing issue. Vaginal moisturizers, which are different from lubricants, can be used a few times a week to keep the tissue more hydrated in general, not just during sex. This can be especially helpful during and after menopause or after childbirth. Talk with a gynecologist about options, including localized estrogen if that's appropriate for you. If you have sensitive skin or a history of irritation, look for lubricants without added fragrances, flavors, glycerin, or warming agents. Those extras often cause more problems than they solve. You can patch test a tiny amount on your inner arm before using it on more sensitive areas. One more important point, needing lube is not a failure. It's like using glasses when your eyes are tired or stretching before a workout. It's just working with your body instead of against it. Now let's talk about something a lot of people skip, even though it can completely change whether sex feels good or painful: how you're pacing arousal. The third way to reduce painful sex is to slow down and let your body fully warm up. Most of us were exposed to a version of sex that looks like kissing for 30 seconds, maybe a quick touch, then straight to penetration. That script works for almost nobody long term, and it's a recipe for pain. Your genitals, whether you have a penis or a vulva, are not on-off switches. They're more like dimmer switches. Blood flow, lubrication, lengthening of the vaginal canal, relaxation of the pelvic floor, and increased sensitivity all take time. For people with vulvas, this is especially important. The vagina lengthens and the cervix lifts slightly as you become more aroused. If penetration starts too early, before those changes happen, you can feel a lot of uncomfortable pressure or hitting a wall inside. The tissues are also more delicate when they're not fully engorged and lubricated, so micro tears and soreness are more likely. For people with penises, rushing can mean trying to penetrate before you have a full, comfortable erection, which creates extra friction and bending that can be painful. It can also throw your nervous system into performance anxiety, which tightens muscles and lowers sensation. What does slowing down look like in real life? It can mean spending much more time on things like kissing, touching, oral sex, massage, and simply cuddling naked without a fixed goal of penetration. It can mean checking in with yourself or your partner and asking, "Do we want to go further?" instead of assuming sex has to follow a preset script. If you're the partner who tends to get aroused faster, this is where generosity comes in. You might need to consciously slow your own pace and enjoy the build-up more, instead of racing toward what you think is the main event. If you're the partner who warms up more slowly, your job is to speak up. "I need more external touch first," or "I'm not ready for penetration yet, but this feels good." Sometimes reducing pain is as simple as giving the body an extra 10-15 minutes of real, focused arousal before anything goes inside. That gives blood vessels time to open, tissues to swell and lengthen, and the pelvic floor to learn it's safe to soften. Speaking of the pelvic floor, that brings us to the next key piece. The fourth way to reduce painful sex is to work with your pelvic floor muscles instead of having them locked in defense mode. Your pelvic floor is a group of muscles that sit like a hammock at the bottom of your pelvis. They support your bladder, bowel, and reproductive organs. They're also deeply involved in erections, ejaculation, and orgasm. When these muscles are too tight or too reactive, which is very common in people with a history of pain, anxiety, trauma, or even just years of clenching, they can make any kind of penetration painful. For people with vulvas, this can show up as burning or sharp pain at the entrance of the vagina, a sense of being too tight, or feeling like your body is pushing things out. For people with penises, a hypertense pelvic floor can cause aching in the base of the penis, perineum, the area between the genitals and anus, or deep pelvic pain with arousal or ejaculation. A lot of people are told to do Kegels to strengthen the pelvic floor, but if your issue is pain, often the problem isn't weakness. It's that those muscles never really relax. In that case, more squeezing can actually make sex hurt more. So what can you do at home? First, learn to feel the difference between tension and relaxation there. Lie on your back with your knees bent and feet flat. Take a slow breath in, letting your belly rise. As you exhale, imagine the area between your sit bones, pubic bone, and tailbone gently softening and dropping, like a flower opening or a parachute lowering. You're not pushing down hard, just letting go of an invisible hold. Then very gently, as you inhale, you can try a light pelvic floor contraction, like you're trying to stop the flow of urine or hold in gas, at about 30–40% effort. As you exhale, fully release again. The focus is on the release, not the squeeze. You can do this for a few minutes a day, especially when you're not having sex, to teach your brain that it's safe to let those muscles relax. Over time, you can start bringing that same softening into sexual situations. Pausing, taking a slow breath, and consciously letting your pelvic muscles unclench before and during touch or penetration. If you find that even the idea of penetration makes your body clamp down, or if you've been told you have vaginismus, pelvic floor physiotherapy can be life-changing. These are specialized physical therapists who work with the pelvic muscles internally and externally, teaching you how to relax and lengthen them again. As a urologist, I refer people to pelvic PT all the time, men and women, because it's such a powerful tool for reducing pain. Now let's talk about something more mechanical but equally important: position and angle. The fifth way to reduce painful sex is to use positions and angles that fit your body, instead of forcing yourself into whatever you think sex is supposed to look like. A lot of pain during penetration is about where pressure is landing and how deep something is going, not just the fact that penetration is happening. For people with vulvas, deep pain, like a sharp ache or feeling like someone is jabbing your cervix, is often worse in positions where penetration is very deep and the angle is straight on. Classic examples are doggy style with a lot of force, or someone on top of you with their full weight and long thrusts. Positions that usually allow more control and comfort include you on top facing your partner. That way, you can control depth and angle, leaning forward or back to find what feels best, and stopping or shifting the moment anything hurts. Side lying or spooning, where both of you are on your sides. This tends to naturally limit depth and be gentler on the hips and back. Variations with a pillow under your hips or lower back to change the angle slightly until you find one that doesn't poke or press in the wrong spot. For people with penises, pain can come from too much bending force, especially if your penis curves or if there's Peyronie's disease, scar tissue causing curvature. In that case, positions where your penis gets bent sharply down or up can be uncomfortable or risky. Side lying, or positions where your body moves with your erection rather than against it, are often more comfortable. It's also okay and smart to use your hands to guide. If you're being penetrated, you can literally reach down and adjust angle or depth. If you're doing the penetrating, you can go slower, use shallower strokes, and check in. Is this angle okay? Deeper or less? Or remember, normal sex is whatever works for the two or more bodies involved, not whatever you've seen in porn or heard from friends. There is no gold medal for enduring positions that consistently hurt you. Now, behind all 5 of these strategies, there's one more thread we need to name: communication. None of this works well if you're trying to do it silently, hoping your partner magically reads your mind or that your body suddenly changes without any adjustments. You don't have to give a lecture, you can start small. Before you're in the heat of the moment, maybe say something like, "Hey, sometimes things feel a little uncomfortable for me during sex. I've been learning a bit about it, and I'd love for us to experiment with some things that might make it feel better for both of us." Then, in the moment, let your partner know in real time what helps. "A bit more lube, please. Can we slow down?" That angle is a little intense. Can we try side lying? This touch feels really good. Can you stay right there? When you pair these simple sentences with the physical strategies we've talked about, respecting pain as a signal, using more lubrication, giving your body more warm-up, relaxing the pelvic floor, and adjusting positions, you're not just reducing pain, you're also building a safer, more connected sexual space. And that, in itself, reduces the anxiety and muscle tension that feed into pain. Let's pull this together. If sex has been painful for you, it's completely understandable to feel frustrated, ashamed, or even hopeless. You might be wondering if this is just how it is now, especially if you're over 30, have had kids, gone through hormonal changes, or had a bad past experience. From a medical perspective, here's what I want you to know. Painful sex is common, but it is not something you're doomed to live with. For some people, a full evaluation and specific treatments, like treating infections, addressing endometriosis, managing prostate inflammation, or working with pelvic floor therapy, make a huge difference. For others, simple everyday changes in how they approach sex are enough to turn things around. Those changes are exactly what we've covered. Stop pushing through pain and start treating it as useful information. Take lubrication and moisture seriously, and don't be shy about using plenty of the right kind of lube. Slow down and let your arousal actually catch up before you attempt penetration. Teach your pelvic floor how to relax, not just squeeze, and get help from a pelvic PT if you need it. Use positions and angles that work for your body and communicate openly with your partner as you experiment. None of these require you to become a different person. They don't require expensive gadgets or extreme routines. They're about listening to your body with more respect and working with the way it's built. If you're watching this and thinking, honestly, this is me, but I've been too embarrassed to bring it up with anyone, consider this your sign to take one next step. Maybe that means trying more lube and a slower warm-up the next time you're intimate. Maybe it means practicing that pelvic floor relaxation for 5 minutes a day. Maybe it means booking an appointment with a urologist, gynecologist, or pelvic floor therapist and simply saying, "Sex hurts and I'd like to understand why." You deserve sex that feels safe and, over time, genuinely good, not something you dread or endure. If you feel comfortable sharing, I'd be interested to hear in the comments, without any explicit detail, which of these 5 areas you think might help you the most. Is it lubrication, warm-up, pelvic floor, positions, or simply learning to say pause when something hurts? And if you want more honest, medically grounded videos on sexual health that respect your intelligence and your privacy, consider subscribing. My goal is to give you the kind of clear, non-judgmental information most people never get in a doctor's office. Take care of your body, listen when it speaks, especially in the bedroom, and I'll see you in the next video.